when it comes to the embryo grading, how much do these tags and numbers matter?
Well, when I first got into human IVF, we did day 2 transfers, right?
Mm,
So we wanted to transfer embryos at 4 cells
early
on day
one, yeah.
2.
Mm-hmm.
And the pregnancy rate spot from doing that was around, 10 to 15%. That's if you were the good lab. You were happy to have that.
Mm-hmm.
There were a couple places in the country, Cornell back in the day, they had like 20% pregnancy rates. Like those guys are lying. There's no way you could get 20% pregnancy rates. And then we said, let's go to day 3. And we actually increased our pregnancy rates by, we went from say 15% to 30, 35%. But what also went up with that is the multiples. It was,
Mm,
back in those days, it wasn't uncommon to have a 30% twin rate and a 10% triplet rate,
wow.
much less quads and more. And so today, I don't really know many people transferring on day 3 anymore. Most people go to day 5, which is a good way of embryo selection, right? It makes my job easier to transfer that blastocyst.
Right.
Now, David Gardner actually did a lot of the nomenclature for blastocyst. He was one of the first designers of the developers of sequential culture systems that we could culture embryos out longer. And so what we call it the Gardner system. It's almost universally used unless somebody is trying to create their own system, like the Anderson system, which I haven't done. I follow the Gardner system. So in that, what you're looking at is qualities of embryos. Some of them just arrest, like I said.
Yeah.
But ultimately, what we're looking for is this expanded, or in Gardner system is a 4, or better, 4, 5, or 6. So it's expanded, it's hatching, it's hatched. And then we're also looking at the inner cell mass. It's a little dense area in the embryo that becomes the baby, and then the trophectoderm, that's the multicellular area around the embryo that becomes the placenta.
Hmm.
And so what we're looking for is almost like a mosaic effect. If you've ever seen a picture of your embryo, it'll almost look like a stained glass window, like all the little diamonds and stuff in it. And so that's what makes them more beautiful. The more diamonds there are, the better the score, the A. The fewer diamonds there are, the lower the score. That'd be like a C.
Hmm.
Now, just like the A, B, and C, if you had a C grade embryo and you transfer it, that means there's not a lot of cells there. And if you think about it, that trophectoderm makes the root. That's what implants into the uterus. So if you don't have a lot of cells in that trophectoderm, basically you get only a few little tiny roots, and the embryo doesn't really take a nice tight hold.
Okay.
It's not always 0, but it's much less for a C grade embryo. And if you use the other way, the C grade inner cell mass, that means there really isn't an inner cell mass. And so what you get is that's where some of the blighted ovums come from. You can have it a sac, but now there's no baby growing in it. And that's either way, that's a sad outcome. You don't want that outcome for the patient. So, their A's and B's are always going to be your better embryos. And if you ask me which one was better, I couldn't tell you. Be honest with you. I always say in the bell curve of life, a lot of things end up in the BB range.
Yeah.
Just because it fits nicely, and the pregnancy rates are just as good as say the AAs. Very, very minimal difference between the two.
That's good.